the hot favorite, black pidre horte. Black is hot. Okay. And what about the white pidra, guys? Trichosporon bijli. Bijli is white. Remember that. Pityriasis versicolor. This is typical of Pityriasis versicolor. Okay, and that you already know that it is having a spaghetti and meatball appearance, and it grows on SD and all that. I will not be going deep in that. So this is a typical picture of this. Fine. The question which can click you in the exam is this particular one, that trichophyton is cylindrical. Okay, and the microsporium is this particular spindle shape, and the boat shape one is epidermophyton, club or boat shape. Okay, so they can ask you regarding this, and which particular one is not having the any conidia and all. That is the epidermophyton is having no microcondia. Remember this. Okay, and ringworm infections are very common. This is ringworm. Okay, this is Tenia's ringworm. So these all are ringworm infections, and this particular is a typical picture which you get when you put it in 10% KOH. Okay, and you leave it for some time, and after that, when you see under microscope, you see this fungal elements. So if you're able to observe up, that means positive. Okay. Besides that, this is the medulla bodies which are coming in the exam for sure. That they are seen in the chromoblastomycosis medulla bodies, and they will give you a history of woodworker and having a varicose lesion. Sporotrichosis, rose Gardner's disease, that you already know, and lymphocutaneous spread is there, rose Gardner stuff. That history you have to look out, and the flower-like sporulation and all that stuff. Besides that, coccidomycosis, the spherules and the arthroconidal arrangement. In the blastomycosis, typically 8 appearance that is observed. In the paracoccidomycosis, you have that Mickey Mouse appearance. Okay, South American disease that is there. Fine. This is they can show you this particular picture only, and they can ask which infection. That is oral thrush. What is drug of choice? Fluconazole. Candida albicans is a fungus which shows 2 phenomena: Renault blot phenomena and the chlamydospore formation and corn meal agar. So that also there, and this is that Renault blot phenomena. That is the germ tube formation. These are the germ tubes. So they can show you this picture, or they can mix it with the HIV stuff, and they can give you that this infection happened up in HIV positive person, and you have done this particular test. So they can mix up in any ways, and they can show you this also. This is the yeast form, and this is the budding yeast cells. Right? So that is there. And down you can observe up the chlamydospore formation. This is the chlamydospore formation. This is the chlamydospore formation on the corn meal agar, which is a nutrient deficient media. Okay. Now coming to the another hot favorite of the examiner, that is the cryptococcus. Definitely one question is there. There's a negative staining because it stains the background, and what you're observing up a thick capsule of it in the negative stain. There was a question that in a test for the cryptococcus meningitis, you have a CSF. Which particular thing you will like to do? Negative staining or latex agglutination test? So guys, this is initial test, but the confirmation is obviously by what? Latex agglutination test for the capsular antigen in the cryptococcal meningitis. This also needs to focus upon. And on the colony front, they both look like same. You can't distinguish between them. And regarding the pneumocystis carni, you go for this particular staining, the GMS. That is ball you take up by this bronchoalveolar lavage, and you go for this particular staining, and you can see the blackish colored cyst which is observed in this particular one. Fine. In this pneumocystis carni, and it's a controversial fungus because it does not grow on the STA. So this also needs to focus upon. And drug of choice for pneumocystis carni pneumonia, that is cotrimoxazole, another hot favorite question. Okay. Now guys, this is aspergillus, and aspergillus is having a septate or a aseptate hyphae. It is having a septate hyphae, dichotomous branching at 45-degree angle. Okay, so this is not that particular form in which you got to see this septate stuff. So tissue biopsy, when you do, you find this septate hyphae, and the angle is how much? 45-degree. Okay. Asteroid bodies, they are seen in the sporotrichosis, which is also termed the rose Gardner's disease. And another thing which is observed in the sporotrichosis, cigar or bundle shape, this particular oval-like yeast form, which is observed, cigar-shaped yeast cells, that is observed, and flower-like sporulation is also observed here. Now, the famous mucormycosis, which is coming nowadays a lot. So this is what is the typical one that is there. They are also termed as lid lifters, and if you observe them properly, they look like what? Ribbon. So this is ribbon shape, fine, and they are lid lift. They lift the lid in which they grow. Okay, that's why they are termed as what? Lid lifters. Now, regarding the mucormycosis or this zygomycosis, they are the same thing. Okay, in them the rhizopus, abside, and mucor they come. And what is the typical of them? They are aseptate hyphae at an angle of 90 or obtuse angle there at 120 degrees stuff. So that is typical of mucormycosis. Happens to be in whom? Happens to be in the diabetes mellitus fellows. Okay. And nowadays, why it is so common? Because the patients, they are under the steroid use, and because of the diabetes happens or stress, these all things are there. Or might be some thing related with the oxygen, industrial oxygen also, and that's why these cases are increasing day by day. So broad ribbon like stuff that is observed, septate one. So answer is regarding the mucor. And if it is a septate hyphae at an acute angle of 45, then you are dealing up with what, guys? You are dealing up with the aspergillus. Okay, aspergillus infections are very common in the diabetes ones, and the mucor infections are also very common in the diabetes individuals. Now another question which can be there is this dimorphic fungus stuff, that is regarding the blasto, coccidio, histo, and paracoccidio and sporothrix. These are there. Okay. And if I go just once, I will tell you that which particular things you need to focus upon here. So focus upon in this particular one, that is regarding the blastomyces. What you have to observe up, you have to focus upon this particular 8, that is figure of 8 appearance in the east. And how you remember this? B looks like what? 8. Then histoplasma, you have this tuberculate microconidia, which looks like a sunflower. Then paracoccidios is having this Mickey Mouse appearance. You have to imagine of the Mickey Mouse ears. And sporotrichosis, which is a dimorphic fungus, it is flower-like sporulation, and it is a narrow base budding here, as seen in the histoplasma also, narrow base budding. And sometimes what you get, cigar-shaped yeast cell also. What you observe? Cigar-shaped yeast cell also. And if you remember up, we have given up a mnemonic for this, HSBC. Okay, that is a bank. Histoplasmosis, sporotrichosis, blastomycosis, coccidioidomycosis, paracoccidioidomycosis, and one is paniciliosis. These are the dimorphic fungus. Okay, so this much like in the virology and fungus which you need to focus upon in the exam. Okay,